Yes, welcome to the second edition of my talk today. Today, I'm going to expose a disease called ulcer. Yes, ulcer is a dreaded disease that kills a lot of ignorant people. Now, I want to start by telling you ulcer. Ulcer it is a disease that occurs in the body. Now, ulcer has a husband and a wife, which also gave birth to another child. The husband and wife of ulcer is called the peptic ulcer and the gastric ulcer. And both of them gave birth to what they call Helicobacter pylori. They call it H. pylori. Some medical terminologies, which I might not be able to tell you, but I will make a layman understand what ulcer is. Now, how did ulcer occur in a human body? It starts this way. In a human system, ulcer, in a human stomach, there is an enzyme which secretes into your stomach called hydrochloric acid. This hydrochloric acid helps to digest your food. Now, our system is designed in such a way that looks like automatic. But this automatic is created by Almighty God. Now, when you are supposed to eat your food at a particular time, you did not eat. This enzyme is being secreted into your intestine. And that enzyme is called hydrochloric acid. That hydrochloric acid is being poured in on top of your intestine. And this hydrochloric acid is very, very harmful to the intestine when it's being poured like that. The work of this hydrochloric acid is just to digest your food. But when you are supposed to eat, you are not eating. As soon as you get to the time, your system secretes hydrochloric acid to the wall of your intestine. When it secretes it there, it keeps harming the intestine gradually. Now, a time will come when you eat your food that contains something like pepper, something like spices. Already, that hydrochloric acid has already created a wound in your system. Thereby, when you eat that pepperish food, it go and activate it. It makes you unrestless. That which is called peptic ulcer. And now this peptic ulcer grows down to get to the wife, which is called the gastric ulcer. Now the gastric ulcer is one that contacts all the diseases inside your food and takes it to your bloodstream from that intestine wall that has a wound already. So when it takes some of those infected food to your blood system, now a child is being born. They call that child Helicobacter pylori. Please, I'm using this terminology for you to understand what it means. Now, Helicobacter pylori, H. pylori, is a disease that is formed and transformed into your bloodstream. It goes around your body, and at the end of the day, it causes what they call waist pain, back itching. It looks like as if you're having arthritis in your leg, but that's not arthritis. It's like a pain with a hot sensation in your leg, pure hot sensation. This hotness will keep coming. Sometimes people don't know. They will say, you've matched juju. It is not juju. There's a virus in your system that is causing this harm in your system. So the whole thing will disorganize your system. Now, how do you cure this? There's triple drugs they use in curing this: amoxicillin by Bicham, tetracycline, and flagyl. These are the three drugs that you keep taking by doctor's prescription or pharmacist's prescription. This drug will help you to be healing. Now, the intestinal healing will come in when you take a kind of what the drug they call gestid, this gestid is like a coolant that will cooling the wall of your intestine. Then there are so many of them that works like Gestid, which I'm not here to advertise them, but I will tell you Gestid is part of it. You can take it, it cools your system. Now, during this time we are taking all this amoxil, amoxil take care of those virus in your system. Once it cures it, does not mean that the virus has, that your ulcer has gone. No, there are still prevention. There are some certain prevention you need to do to make sure it heals permanently. Because once a wound is created in your system, you need to allow that wound to heal properly, thereby observing some protocols which will allow it to heal. Just like you having a wound in your hand, before you know it, you peel it off, you see fresh blood will start coming out again. If care is not talking, your blood will be infected again, you start all over. So these are the food you try to avoid for that wound that is created inside your system to be healed. One, you stop any food that contain acid. That acid, most food contain this acid. Now, these are the food. You stop orange, you stop Fanta, you stop Coke. Coke contains the excess gas that will initiate the process again. You stop orange, you stop eating gari. Gari has a teeth that can go and brush the wound again. These are the things. Now, some certain food you need to stop eating, even alcohol, beer, you stop taking them. Not that you want to stop them, but you need to allow that process to heal properly so that you can go back to your normal self. If care is not taken, the thing will degenerate to a bigger disease that can take human life. So what I'm saying in essence is there are food you need to avoid. Those foods are orange, sometimes pineapple, sometimes excess sugar, bread. Some of these food that contain sugar. There are some other harmful foods that contain some acidic, which will go and react. So most times you watch your food, what you eat. You eat something like pap, some soluble food that are not harmful to the body. You eat pap, you eat man rice, not too much stew on it. You eat unripe plantain, avoid some pepperish foods or spices. So keep the wound, give it a time so that it will heal the wound properly. Thereby, you can go back to your normal food. But going back to your normal food does not mean that there are some tendencies that might need to reactivate it again. But you need to avoid them gradually, or if possible, you avoid them completely so that it will help you to heal the wound completely. So, my brothers, if you have other questions to ask, please click on my like. You follow us, you get more information. Thank you very much. Like me, follow me on my TikTok. I'll give you more information about some other diseases and how they function. Thank you very much.